viewers, I am Dr. Ritika Sharma and I will be telling you about PCOD in this session. So this session is exclusively for females. Any female who is suffering from PCOD, they can share this video with their friends who are suffering from PCOD so that everybody can get knowledge about this thing, that what is PCOD, is this treatable, and is this major cause which is not letting them getting pregnant, is this causing infertility in them. So share this video and watch this video till end. So let's get started. I will start with what is PCOD. Okay, PCOD is polycystic ovarian disease, and if we talk about the prevalence in the population, then about 2.2 to 26% of female population is suffering from PCOD. And you will be amazed by knowing this, that almost 50% cases are undiagnosed. 50% of these cases do not know that they are suffering from PCOD. So number one thing is, if you have these symptoms which I will be telling you later in this video, then consult your doctor to rule out whether you have PCOD or not. If you have PCOD, then start the treatment now so that you can get your ovaries back to normal without causing any problem in your reproductive cycle. Okay. So what are the symptoms of PCOD? In PCOD, generally you have seen that patient gets suddenly obese without any cause. Okay. Thyroid level also shoots up. The patient have facial hair growths. So these kind of symptoms are indicative towards PCOD. If you have a sudden weight gain, and that too around your abdominal area. A generalized obesity is not seen in maximum cases of PCOD. Abdominal obesity is seen in majority of the cases of PCOD. If you have a sudden weight gain, then it is a question mark for PCOD. If you have your thyroid hormone imbalance, a hypothyroid condition, then it is also a question mark for PCOD. If you have irregular menstrual cycles, either your cycles are delayed or your cycles are very early, or you see some stains or spots in the middle of the cycle, then also it is a question mark for your PCOD thing. And if all these symptoms along with facial hair is also there, then it is also a big question mark that whether you have a PCOD or not. If you undergo or recognize any such symptoms in you or in any other female, then you must see your doctor right then and there so that the PCOD does not progress, the ovarian volume does not increase much, that it is beyond your treatable condition. So monitor your weight, see whether you have menses regularly, and if you have any disturbances, go and consult your doctor. So clinical features of PCOD which we see in the patients are amenorrhea. Alright, there is sudden weight gain around your belly. Belly fat is the major question mark for such patients. Then acanthosis nigricans. This condition is mostly seen in PCOD patient. This condition is exact if a patient have PCOD and if a patient is obese, then acanthosis nigricans. It means that the neck area will be black and pigmented. The armpit area will be darker. The groin area of a female will be darker. And this darkness is due to insulin resistance. So if a female have obesity and along with this obesity she have darkness and pigmentation on her neck, darkness in her armpit area, darkness in her groin area, then these are the clinical features of PCOD. So I hope that symptoms and clinical features are clear to you now. Now I will be discussing about certain pathological changes which happens in a PCOD patient. Whenever we see a ultrasound of a PCOD patient, then if the volume of the ovaries is more than 10, then we consider that it is a PCOD case. This volume can vary beyond 25 also, but majority cases of PCOD comes under 17 cc to 21 cc volume. So this volume increase because of the formation of multiple follicular cysts, okay, in the ovaries. So that's why the ovarian volume increase in the polycystic ovarian disease, because multiple follicles develop and eventually they become follicular cyst. And the size of these cysts varies between 2 to 9 mm. Apart from this, certain investigation things I will be telling you. The first of foremost investigation which we do in the case of PCOD is ultrasound. If a female is extremely obese, then we advise for a transvaginal ultrasound. Otherwise, we refer her for lower abdominal ultrasound. In that, if the ovaries are bulky and the volume is increased and the size is increased, then it is correlated with the PCOD morphology to check whether it is a PCOD or not. Alright, though it is indicative of PCOD because ovarian volume is very high, more than 10 cc. And second investigation which we ask patient to go for is serum test. In serum test, we check whether the LH and FSH ratio is within the limit or not. Because if the LH and FSH ratio is more than 3:1, then it is definitely a PCOD case, and we consider it under PCOS, that is polycystic ovarian syndrome case. Okay, because in polycystic ovarian syndrome, there is a very thin line difference between PCOD and PCOS. In PCOD, only the ovarian symptoms are there and few associated symptoms like obesity. But in your PCOS case, there is an ovulation along with PCOD. There is an ovulation or hyperandrogenism. In PCOS case, if there is any two conditions among these three, then a case is known as PCOS. The three conditions are anovulation or oligo-ovulation. Number second, hyperandrogenism. Number third, polycystic ovarian disease. So out of these three, if any two condition fulfills, then we consider that particular case in the PCOS category. Okay, and PCOD is treatable if you will reduce at least 10% of your body weight. Then you will help yourself automatically that your irregular menstrual cycle can be regularized only because of weight reduction without any medication. So if you do regular exercise, you focus on your food, then also you can reduce at least 10% of your body weight and you can get your menses on your regular time. And apart from that, holistic treatment is available in various alternative medicines like homeopathy, Ayurveda. There you can get the solution for PCOD treatment. And PCOD holistic treatment is available under my Dr. Ritika's Healing Center. You can go to the website and check out what are the procedures there. And if you are suffering from PCOD, it is the right time to opt for your treatment holistically. Holistically means that it will not harm your body. It will only provide you benefit. And these ovaries are the major part of your reproductive system. To become a mother, it is mandatory that you have a healthy ovary. Okay, so don't ignore these symptoms. If you have sudden weight gain, if you have disturbance in your thyroid, if you see that there are some facial hairs coming, if you have irregular menses, then consult your doctor immediately. So I hope that I have cleared your certain doubts regarding PCOD. What is it? What are the symptoms? What are clinical features? And what investigation we usually ask patient for, and what we see in that. So I have told you about serum test and ultrasound, basic LH and FSH ratio. And for further details, subscribe to the channel, or if you are seeing this video on any other platform, then just comment your queries. And there is a group I have made especially for PCOD patients, that is Dr. Ritika's Healing Center. So this is the name of the group. You can join that group and post your queries into that. So see you in another session, and always remember that your dietary habit and your weight reduction can help you in regularizing your periods without medication. And for your ovaries size to become normal, your ovaries internal environment which have follicular cyst, multiple follicular cysts, to get it normalized, you will require a holistic treatment, and that is available. You can check the link under this video. So see you in another video. Be healthy and keep exercising.